AF affects over 33 million people globally, and right here in the United States, 5 million. The symptoms can be quite debilitating, and the impact is enormous on the healthcare system. Today, I'm very fortunate to be joined by two experts on AF to share their expertise on their current treatment options to address this disease and discuss how to optimize outcomes. Dr. Suneet Mittal and Dr. Kedar Sankolkar.
And in my experience, if a patient fails one drug, they often fail more. And that's when I send them to you, Suneet, much earlier than I've done in the past.
From my perspective as an electrophysiologist, I agree completely that there is an opportunity to effectively treat more patients and earlier with catheter ablation. That is why a partnership with our cardiology group helps us put the AF patient at the forefront of receiving the most optimal treatment, which for many patients is catheter ablation. AF as a disease continues to progress, and if you treat it earlier, you can slow or stop this progression. Now, this is one study that aims to prove this point. In this study, patients were ablated, and the investigators saw what their progression of atrial fibrillation was. And what they found was when they compared this to a matched cohort of patients with atrial fibrillation who were treated with drugs, the patients who underwent ablation had a lower rate of AF progression compared to drug therapy alone. Furthermore, if we look at another study and you compared patients who underwent catheter ablation versus those who were treated medically, these investigators found that catheter ablation was associated with a lower risk of stroke and a lower risk of mortality compared to patients treated medically.
AFib happens for a multitude of reasons, and controlling and addressing those risk factors sooner rather than later is very important, and then working with them through the entire process, even after I refer to Suneet, is very important. It helps with prepping them for the actual AF ablation and then ensuring success after the ablation.